right. I think we are live. Welcome everyone to our latest edition, our latest episode of the 300 Fathers podcast. I'm your host, Troy Woods. I'm super excited right now to be coming to you all live today with this recording um, with a special guest who our paths have connected through business. But now I feel like this is just a perfect time, especially for what her expertise happens to be, that she could come on here and take some time out of her busy schedule to share with us some nuggets to kind of help us all. Now, you all know that today we're going to be talking about depression in teens and the way forward, and just a little bit about Dr. Alfiee. Our full name is Dr. Alfiee Breland-Noble. She is a media personality, a gifted public speaker, researcher, and a fully licensed psychologist in 2 states and the District of Columbia. She's realized her passion for helping racially diverse young people, teens, young adults, and young at heart achieve optimal mental health via research and care for depression, anxiety, and other mental illnesses. She travels widely as a sought after keynote speaker, trainer, and scientist, and has been featured in national and social impact media, which includes A&E TV, PBS NewsHour, NBS Nightly News with Lester Holt, radio, podcast, print media. She's an in-demand consultant with K through 12 public and independent schools, community-based organizations, colleges, universities, nonprofits, and professional organizations. So, ladies and gentlemen, if you guys could please help me welcome Dr. Alfiee. We call her Dr. Alfiee, but it's Dr. Alfiee Breland-Noble. How are you?
I'm wonderful. How are you?
I'm doing great.
Yeah.
In these times that we're in, I'm doing great. I really can't complain. We're together with family. It's just like we were talking before we went live.
Yes.
It's just a new norm,
Yes.
and I'm doing well. How are you?
I am wonderful. I don't want to get too like metaphysical and spiritual, but I really am a believer when we're upright. I'm at that age where you say when you're upright, it's a good day. So,
Right.
I'm upright. It's a wonderful day. So I am good. I am wonderful. Thank you for asking.
Excellent, excellent. You know, I as a father, just to kind of give you a little bit of backstory about what we do, we're 300 Fathers is all about developing high performance fatherhood. And that encompasses so many different areas because as a male, I can tell you we are complex individuals.
Yes.
We have a lot that we don't talk about, a lot that we don't share. It comes out oftentimes in ways that maybe we wish it would not come out. But we have our most precious commodity in our children, and our children also are complex individuals
That's right.
from all walks of life. And so I have greatly admired ever since we started working together on the media side. I've greatly admired what your work is in our community, and I feel as though you have so much to offer. Your insight's incredible, and so today I wanted us to have a conversation on, just as we said, depression in teens, particular,
Yes.
and the way forward. And this conversation was brought about from our last, I guess, business dealings that we
That's
had.
right. That's right.
And so, if you would, I'm not gonna, I'll jump in and kind of ask some questions here and there. But if you would, I was interested in finding out, how did you get started down this career path,
Yeah.
in this particular area of study?
Yeah, so it's a wonderful question and I really appreciate it. And I know I don't necessarily have to say it, but I feel like it's important for me to say thank you for having me.
Oh, you're welcome.
It has been a pleasure to work with you. I'm so happy to support and be connected with a Black owned business, particularly from the brothers, just because, as you said, men are so complex and
Mhm.
African American men, Caribbean Black, African immigrant Black, Black Latinx brothers are very complex and you have unique needs. And so
Mhm.
it really has been heartwarming for me every time we've worked together to see just to watch the crew walk in. I'm like, yeah, that's brothers. Like my little 13-year-old, I'm like, see, you see that? Them brothers handling business. So I'd love to be able to show him that in multiple ways. So it's wonderful. And so for me, part of how I got into this work is growing up. I've shared this story a couple of times before,
Mhm.
so I feel like a broken record. So I apologize.
No, no, no.
But I grew up in an area called Virginia Beach, Virginia. Shouts out to all my crew, my girls. They know who they are, PRR crew. It was an environment where there were three primary racial ethnic groups. African Americans, mostly, because there were not a lot of African and Caribbean immigrant folks back then. There are now, but there weren't then. I'm a Gen X kid. And whites and Filipinos. I did not say Asian, I said Filipinos, because Filipinos, that's who was in our area. So, you know, that's just the environment that I grew up in. And I want to practice my little bit of Tagalog, but I'm not going to mangle it today. So I'm going to leave that alone. But I did grow up in that environment. But even though it was racially diverse, it was not always so integrated. And I think for me, what it demonstrated was that you can have, I think there's a choice that we have. It was a different time. It's very different than it is now. And I think the choice is either you can sort of have a stew with all the little pieces floating around, or you can have a puree where you blend it all together. And I think what we had was a stew. There were sort of pieces floating around and they never really meshed, and we never really got a good flavor together. And I think the way that manifested itself was I saw a lot of my friends struggle around issues of race and diversity. Okay. I also saw a lot of my friends struggle around being in a predominantly white environment where we as Black kids were not valued. I mean, I'm a public school kid, and we just weren't. And so that manifested itself in a tiny, teeny number of us Black kids being in advanced academic classes. There were far more of us who were qualified to be in those classes, but were not there. And so there were like 8 of us, and I know the same 8. I'm still in touch with all of them. I actually saw all of them last year, like every single one of them. That's how small the circle was of the advanced kids. Right. That was really the impetus, because we struggled. I know I struggled personally. Where did I fit? And not knowing where you fit and having a place led to probably, if I were to see a kid who was like I was then, I would probably say that kid was borderline clinically depressed, or maybe like sort of on that path, right, to being depressed. And I think for me, it was that coupled with, this was the 80s. So the divorce rate was skyrocketing. Everybody I knew, parents were in some stage of divorce, already divorced, on the, next marriage, getting ready to get divorced, separated. And so that was stressful. And I think for me, what it demonstrated was there were these glaring disparities. There were kids who had support, which I felt like I was one of those kids, emotional support, and there were kids who didn't. And I knew then that I wanted to be a person who, when I got bigger, I wanted to be a support for those young people who did not have support. Gotcha. That's really what it was for me. I wanted to offer that kind of support around all the issues that I just described. So that's really what pushed me in that direction. And finally, what tipped me over the edge was my godmother is an early childhood development. She has a doctorate. Her name is Dr. Mona Thornton. Okay. And Mona said 2 things. She said Howard University, and I was sold. I applied nowhere else. You cut me, I bleed blue and white. I'm HU all the way. HU, And she said, I think you need to think about psychology. So that's a long-winded version, but that's really what got me to this place.
Wow, that's interesting. I know, growing up, I call it, my mom, she was on her second marriage.
Yes.
And he was a military guy. He was in the Air Force. So I lived in Guam for 4 years.
Oh, wow.
And from 6 to 10.
Yep.
And I think what helped me a lot was, in military in general, you have people from all walks of life.
Yep.
And it's almost like it doesn't really matter what their pre-notions were. The military is the common bond.
That's it.
So you meet so many types of people, and you learn to work together, and you learn how people think.
Yes.
That don't look like you.
Yes.
But it seems like today, our younger generation, and as they get into their formidable years, and as they get into their teen years, they're not really taking the time to really diversify their mindset, and they're just looking what's in the box.
Yep.
And so my question to you would be for people who may, especially now at the time that we're in, because nobody's going anywhere.
Right.
And we've always looked at, hey, I do a lot of traveling. I go to North Carolina and I go to Florida.
Yes.
That's just
Yes.
kind of
Right.
like the thing, right?
Right.
So for people that are not uh, experienced in traveling and
Yes.
maybe getting outside of their communities,
Yes.
have you in your studies seen a difference in people that have been able to expand
Yeah.
and look beyond, or just this is because and I want to be sensitive because I understand how it is to have pride in your community, how it is to want to work within your community, et cetera, et cetera. But I think sometimes we're so limited, we don't understand that we don't have all the ingredients to the pie. Does that make sense?
Yes, it does.
Okay.
Absolutely.
Okay.
Yeah. So I think you're 100% correct. I think there are, it's like an onion. You keep peeling and there's more and more layers. So I
Okay.
do believe that, and I know from my research and and the research that exists out there in childhood development, adolescent development,
Hmm.
young adulthood, the more you can travel, the more you can engage, even if it's local travel, the more you can engage different kinds of people, whatever those differences are, right? Whether
Right.
that's differences around LGBTQI queer young people, whether that's differences around race, ethnicity, whether that's differences around a person being non-gender conforming, whatever those different nationality, immigration status, all of those things, the more you can be exposed to people who are different from you, the wider and broader your horizons are. So you've nailed it. And I think, like you said, being a military child, I was one too, but my father's Navy, retired Navy, but he got
Okay.
out probably by the time I was like, I don't know, late elementary school, middle school. So we
Okay.
didn't move a lot.
Okay.
But having the opportunity to get outside of what we typically think of as our comfort zone allows young people to do a couple things. One is it builds resilience, right? Because you think about your experience. If
Right.
you're constantly moving and meeting new people, or you have to shift, like you went to Guam for that period of time and you came back, you have to be adaptable, right? You develop, it's like building a muscle, right? So you develop those adaptability muscles. The
Hmm.
other thing that it does is it forces you somewhere inside of you. My brother calls it intestinal fortitude. You've got to develop some strength inside of you to be able to continue to face potential rejection by engaging new people in new situations all
That's
the time.
good. Okay.
And if you don't flex that muscle, what happens? Atrophy, it withers, right? And the way that that shows up in young people is they become not introverted, because that's a sort of personality trait, but they become withdrawn, right? And it
Okay.
gets more and more difficult to open yourself up to people because you're scared of rejection. And that fear can sometimes lend itself to and devolve into anxiety, right?
Hmm.
It becomes a maladaptive behavior.
Okay. Okay. Now, I didn't want to get this deep this early on, but it's your fault. And you mentioned something that I do. I want to talk about this. I want to go ahead and get this out the way now so we don't run out of time and don't get a
Yeah.
chance to discuss it. I know this is a sensitive topic. And as a male, as a man who has my wife and I,
Yes.
we have a son and a daughter.
Yes.
When we talk about depression, um, I want to talk about the gender specific issues
Okay.
because I feel that even someone as myself who's faith based, I think we live in a world where when things happen, people get to the point where they're old enough to make their own decision, and even now
Mm-hmm.
we're letting the social norm seems to be letting children just do what you feel.
Mm-hmm.
And so my concern as a father is how do how do we tie in, or how do we manage when it comes to kids, teenagers, when they're dealing with specific gender issues and
Yes.
depression? Like, what do you see that somebody that may be, you know, that may be gay, maybe lesbian, whatever?
Yes.
Um, what are the ties that you've seen that leads to depression with them that we could, because parents have expectations for their children, all
Yes.
right,
Yes.
and I've seen sometimes when things happen, there's a breakdown in a relationship.
Yes.
So my question to you was, what have you seen to be a breakdown as far as when kids are maybe having challenges with their identity and then it leads to depression, and what could parents do to maybe see those signs and kind of mitigate and manage that?
Yes, wonderful question. And so I think, I'll take the blame for us getting deep quick because we want people to get this information. So again, I applaud you for even asking the question. The first thing I'm gonna say is, as a parent, my kids are 15 and 13. My mom, she's deceased, taught me, she used to say to my brother and me, she said, baby, I don't know that there's almost anything you could do that would ever make me stop loving you. The freedom that came from somebody saying that was tremendous, right? It was tremendous. And she was one of those people, she was super open, super welcoming. She was everybody's mom. Like anybody will tell you that, Miss Maddie. And so for me, that epitomizes where I think we have to start as parents. Part of how we can build that protective shield around our children is to love and accept them for who they are, period. Or as my trainees will say, period, poo, you have to love them and accept them exactly as they are. And they may not be the person that we want them to be, right? And so my thing is, I will tell parents all the time, especially in clinic, as long as they're not hurting anybody else and they're not hurting themselves, you should accept them for who they are. They might not want to do what you want them to do. They might be a queer young person or non-gender conforming or questioning, and that's okay, right? We embrace that because at the end of the day, what's most important is that we, as we said earlier, we woke up this morning, we have another opportunity to love each other. So the first thing is just acceptance. Embrace your child, love them for who they are. And as I have a good friend, Mr. David Johns, who runs an organization that focuses on LGBTQ issues for Black people in particular, like a civil rights organization, the National Black Justice Coalition. I listened to him say, we have to be willing to allow our children to invite us into their lives, right? So he says he doesn't like terminology coming out because that's like you have to take a veil off of something. It's like, this is who they are. So we're inviting you in when I share with you who I am, whoever that is. So acceptance is key. I think what happens is we place expectations on our kids. You know how it is. It was done to us when we were kids. And I think sometimes unintentionally we do it to ours. We have these ideas about what their lives are supposed to look like. Okay. And I think where the mental health concerns and mental health issues begin to crop up is when kids don't feel like they have support and when they're in environments that teach them maladaptive behavior patterns. So to make it a little less technical, there is this, it's nurture and it's nature, right? So it's what's in your environment, but also what's inside of you genetically. And the genetic piece that I'm talking about is the hereditary propensity or the genetic propensity toward depressive illness, right? So if grandmama had it and auntie had it and nobody talks about it, when it shows up in the kid, people are scratching their heads like, well, where is this coming from? Yeah, you knew it was there. Y'all just didn't call it depression because they didn't treat depression, in Black folks in the 40s and the 50s, at least not in healthy ways. So there's the genetic component. Then there's the awareness component and the nurturing component. Awareness means it has to come from back here or out here. You know how we say in different communities, we have different terminology. I had a Filipino young lady tell me once, and you heard me say this before, that in her community, depression is called first world problems, right? What do Black folks say? Not all, but a lot of us, them white folks issue. Black, we ain't got time to be depressed. Right. We came from slavery, blah, 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 right? And so the idea is we don't talk about what depressive illness looks like. So when it shows up in our kids, we either don't know what we're looking at or we see it and dismiss it as something else, which you've heard my girlfriend Kathy say. So part of it is understanding and recognizing it when you see it. Part of it is recognizing that it's in our families. And part of it is embracing our kids enough to accept them for who they are so that we don't contribute to and exacerbate what may be underlying genetically so quickly. If your child is questioning, right? Maybe they're transgender and they're not quite ready to invite everybody into that. Well, if the messages that they hear are all negative about transgender people, what does that do? That's like, it smushes the child down. It pushes their core sense of, that's who they are at their core. It's pushing it down and it is beating up on it, so to speak. And so they don't have an opportunity and they don't feel a desire to bring that out into the world because it's going to get beat down, right? And so if you internalize all that stuff, it just starts eating away at you. And that is what really ends up, I think, manifesting itself as depression.
Ooh, okay. Uh,
It's a lot.
that's good.
It's
That's
a lot.
good. It seems like at times the needle is constantly moving,
Yes.
right? And I know we live in a complex world. I think my concern as a dad
Yeah.
is from a societal standpoint, it seems like we're not our parental grasp
Yes.
feels like it's being stripped away
Yes.
to a point where they don't even really want you correcting your child in public, or they don't
Right.
want you to, it's
Right.
like
Right.
it's like everyone that's making the rules
Right.
didn't grow up with these rules,
Right.
and so,
Right.
and I understand people are changing, but my question happens because I know kids now have social media,
Yeah. Oh, yes, Lord.
and I
Yeah.
know that's that in and of itself. With and the one thing I was happy the Instagram did was they took away the likes.
Yeah. Oh, Lord have mercy. Yes.
They took away the likes because so I saw so many people getting wrapped up into that social proof,
Yes.
and
Oh,
the
yes.
content could have been nothing, but I'm nothing because I didn't get 500 likes on this
That's
picture or a
right.
thousand likes or whatever. So how have you seen social media impact the mindset of teens today? Because it's more so affecting them than younger
Oh, yeah.
kids.
Oh, yeah.
So how have you seen that impact as far as like social media, teenage years? Kind of, have you seen paths change to
Yeah.
where career? Oh, I don't want to do this anymore. I want to do this, and the fight and the struggle from that.
Yes. So, one of my favorite movies, I know there are all kinds of problems with it, but I'm just going to own my stuff. One of my favorite movies is Adam Sandler, The Water Boy. And, Kathy Bates in that movie is like, something is the devil.
Uh-huh.
Social media is the devil sometimes, not
Right.
always, right? And so I
Right.
think for a lot of our young people, it really is like with anything, it's moderation and it's supervision. And so I think what makes social media a little different than some of the things that we grew up with, or I grew up with as a Gen X person, is there was a lot of stuff our parents could control, our
Mm-hmm.
access, right?
That's true.
Social media and smartphones, once you put that smartphone, not just a cell phone, once you put that smartphone in that kid's hand, you lose a lot of control. And so the goal is to prepare your child and to develop a relationship before, I'm going to tell you what the rule should be. 13, 14 years old. And I know a lot of parents are like, Lord have mercy. No, my baby is fighting for it at 10. They don't need it at 10, right? That's too much information and it's too much. It's just too much. And so
Right.
by the time they get 13, 14, we should have developed a relationship with our children where we can, for the most part, trust what they're doing online.
Okay.
I know that doesn't always happen, but I think what happens with social media is we put it all on social media. I think social media sometimes is just a symptom, right? It's just a
Mm-hmm.
manifestation of some other stuff. So if it wasn't social media that they were acting out on,
Mm-hmm.
it's going to be some other stuff they're going to act out on.
Mm-hmm.
So I think the idea is, as parents, to recognize social media is not going anywhere, and to recognize what are the rules that we need to put in place once the child has social media. Let's say we missed the boat in terms of getting all this prep ahead of time, because most of us don't think about that. Once
Right.
they have it, what can you do and how can you support them? Well,
Right.
you can educate them, right? Which means you got to educate yourself about social media, right? So there are all kinds of platforms out there. I was watching oh gosh, Kiki, I forgot the show, Strahan, with Michael
Oh,
Strahan.
yeah, yeah.
Michael,
I know what you're talking about.
that
I don't
show,
know the name,
he
but I
had
know
this
exactly what you're talking about.
generational thing. And she said she was testing him and the other co-hosts who are Gen X on the different social media platforms. And she named some stuff. And I was sitting there like, I don't have no idea what she's talking about. What is that? It was supposed to be some alternative to TikTok,
Mm-hmm.
Triller or something. And so I asked my kids, they were like, yeah, mommy, everybody knows that. Well, I didn't. And so
Right.
that's just an example of, you can get on Google, you can get on the internet and Google the top 10, or I don't know, top social media platforms. You need to know what all of those are. That then becomes conversation with your child. Which one of these are you on? Now, they may not tell you the whole truth and nothing but the truth, but you can at least engage in the conversation, because what are you doing? You're planting the seed. Once they hear you know what TikTok is, for all they know, you might jump on TikTok anonymously and be stalking them. And they don't want that. Do you know what I'm saying? And so we have to educate ourselves first. Then we have to have an ongoing, this is some of the research that we did. Open lines of communication between parents and kids lead to better mental health outcomes. You don't necessarily have to be grilling them all the time, but you do need to be in communication with your children. And I'm not talking about texting. So that when stuff pops up, you have an opportunity to be available when your child wants to pivot and talk to you. They may not always want to talk to you, but you at least want to start planting the seed. Baby, you can come to me and tell me anything. And the first thing I'm going to do is listen. I'm not going to judge, even though inside your brain, you're like, oh my, like you're losing it. But what you're not going to do is you're not going to start mouthing off at them and telling them all the stuff that they're doing wrong. And how could you be so stupid? And I can't believe you did that. Back in my day, we famous for that. So it's open lines of communication. But so it's prevention, right? Waiting until you allow them access to social media. Then it's monitoring once they get it. And it's educating yourself about what they have access to so that you can take the time to also have access to that.
Okay. So you said prevention, monitoring, and then education.
Yes.
Okay.
Both yourself and your child. You need to have a conversation with your child. What are you on that for? Who's following you? Who are you following? I'll tell you a quick story. I was talking with a child, I'll say a teenager, and we were talking about Instagram. And the child was saying, yeah, something, because I can't stand so and so and so. She named like 5 people and she follows all of them on Instagram. And so we had to have a conversation. I said, wait a minute, help me understand something. Why are you talking to me complaining while you sitting here looking at the stuff that's popping up in your timeline because you follow them? Like Monique said, make that make sense. That doesn't make sense to me. And so you got to be able to engage to sort of turn on those critical thinking skills. There's an easy way to get around that. Stop following them. Unfollow. It takes a click of a button. So those are the kinds of conversations we need to be having with kids. And then there's one more. I got to say this. This idea, we've got to teach our young people that these cyber relationships, whatever it is, platonic, dating, you interested in somebody, whatever it is, that's not the same thing as I was going to say brick and mortar, but an in-person relationship, right? I don't know that we can say you are in a healthy functioning relationship if barring the current situation, if the only engagement you have with that person has 100% been online and you've never met them in person. We've got to be able to have the fullness of a relationship. I'm not saying you can't spend a good portion of time engaging them online, but I caution teenagers, baby, I don't know if you dating, if you've never physically met this person in person and your whole relationship has completely been on IG chat. That's not a relationship. So we need to teach them we got to have these conversations.
It's it's funny. I mean, even as an adult,
yes,
I have had things happen recently where I think this is where I really started to understand how powerful the mind was, because and I think social media and teens can possibly tie into, because it becomes their reality. Like they'll have this whole thing laid out and it's not really what's going on. Case in point with me, I was going through something probably for 2 years with some individuals, and because they weren't the type to really, they weren't confrontational, couldn't really talk to them, kind of standoffish. In my mind, I'm thinking all this stuff to the point, and this is where, and I told Kelly, I said, you know what, I got to change what I'm thinking, to the point where my body started changing because of thoughts. Like, I could feel stress coming up in the back of my, and I'm like, what is going on? I mean, I was short with the kids.
Yes.
I'm like, and nothing had happened besides thoughts.
We think that's it.
And so when I was like, if I'm an adult and going through this, and if becomes the reality for children, God, no, if they don't have the cognitive skills to really deal with it, you just start wondering, like, what are they going to do? So my question is, so we have teens, they're dealing with depression.
Yes.
Maybe as a parent, you didn't see the signs.
Right.
Which I think we should, before we end, briefly talk about that. But let's do that now, because I would like to build on that. Sure. What are some signs that as parents,
Yes.
maybe we can see in the early onset of
Yeah.
depression in
Yeah.
teens?
Okay. So what you're looking for is significant changes in your child's behavior that last over at least a 2-week period. So,
Okay.
teenagers, I was a teenager, so I'm gonna own my stuff. I was a super moody teenager, right? It was just,
Okay.
all right. So I'm not talking about that. If that is just sort of, I don't know, maybe a week they're moody, the next week they seem fine, and then it's just kind of they're fine for a while and then they get
Right.
moody. I'm not talking about that. I'm talking about the following thing. So over a 2-week period, what you really want to be looking for depressive illness, like major depressive illness, major depressive disorders, what the clinical term is you want to be looking for, obviously, sadness. They're just kind of low, right? So when I teach little kids, I'll say, think about Eeyore, how Eeyore look like Winnie the Pooh, how Eeyore looks all the time. Just nothing perks him up. That's one. Crying, and you don't know what they're crying about, right? And I'm not, we're really specifically focusing on teenagers because it looks a little bit different in younger kids. So the crying spells, thoughts about death, right? So what I will see is patients will come in. I've had many patients in the past where they like to doodle. And if you look at their note, I don't know how much they do this anymore because I don't know how much paper they use because everything's technology, but they're doodling. Everything you see is like drawings of like skull and crossbones and death. And, it's all like morbid and like bodies being ripped up and stuff like that. Another way it manifests itself is these kids who will sit, I'm not talking about gamers, but they sit and they're on these morbid video games all day, right? And parents don't monitor it, right? So if your child is sitting there playing Doom, right, like 8 hours a day, 5 days a week, you might need to check on that, right? Because that's not healthy. There are other things you want to look for in teenagers and boys specifically, in our Black boys. Irritability, right? And what people will argue is what my girlfriend Kathy says, typical teenage behavior. Okay, yes, some irritability is typical, but if your kid is always annoyed, always irritable, everything gets on their last nerve. Like you can't even sit beside them and have dinner. Dang, why you gotta be chewing like that? Like everything is like annoys them. That's another symptom. Significant changes in eating habits, significant changes in sleeping habits, meaning they used to eat normally, now they don't want to eat anything, or they're eating everything in sight and it doesn't stop and it's all day. I'm not talking about growth spurts. Some of they just eat, and you see these drastic or significant weight changes, a lot of weight gain, a lot of weight loss that differs from what the norm is for your kid. But what does that mean? You got to know what the norm is, which I call you got to know yourself and your child's baseline.
Okay.
Right? You got to be paying attention. So those are some of the signs and symptoms of depression. The biggie that often shows up for our Black and brown children, because it's an acceptable way to express yourself, more so than sadness, is irritability. They're just mad about everything.
Wow. Wow. You see it a lot. I mean, just in our subway systems,
Yeah.
people
Yes.
just mad. Like,
All the time.
and you're like, why are
Yes.
you so mad? Like,
Yes.
it's
Yes.
like it's almost like a defense
Yes.
mechanism, it seems like.
It is. It is because, like I said, it's acceptable. So, like, it's this great song Solange has with Lil Wayne. You got to listen to it. I think it's called Mad. It's off not the last album, but the one before that. And the lyrics, that's what she said. She said, why are you always mad? And then Lil Wayne's rap, he talks about the anger being a mask for dealing with trauma and depression and even suicidality. That's what's acceptable. You say, I see them kids on the subway, and it's not funny, but it's interesting now because my kids are sort of trained. And so we'd be on the subway together, the metro together. My daughter be like, she'll lean over and whisper. She's like, Mommy, I think she's depressed. Or Mommy, I think he's got depression. Because they're so vociferous. Ain't nothing wrong with Black folks being loud. I'm Black, I'm loud. I know this. But I mean, like, just not assertive, aggressive. Right. And maybe they're not trying to hurt anybody, but it's just like, dang, what is wrong with you? You need to calm down. And like the mom in me kicks in and I'm gonna be like, babe, come on now, sit down, stop all that foolishness. But I'm not finna say nothing to nobody's child, right? Because I don't want them going off on me.
Right.
But that's what you will see. So I have a really quick story that's a great example of this.
Okay.
When I was a psychiatry professor at Duke years ago. So there's this young man and they were coming to see me. His mom was making him come see me. And he comes storming in the office and he's just angry and mad. In this office, I was the only Black professional there, the only Black doctor in the clinic. And so when the Black folks came in, everybody knew where they were coming to see Dr. Alfiee. So he comes in, he's angry, and they can't get him to come in the back with me, right? So they said, Dr. Alfee's calling you, come on back. So his mom comes in behind him. She's parking the car. She's horrified because he's screaming and hollering. He's not threatening anybody. He's just angry and irate. And she doesn't know what to do with him. So I don't even know how we got him to calm down. But once we got him to, like, one thing he did was he stormed back outside. And then the mom was worried, where is he going? I don't know what he's going to do. Please help me. Please help me. So that's what I did. I chased outside after him.
Mm-hmm.
I got him by himself. Now we ended up finding out he had depression. The reason he was so upset is because his mom made him get out of the car and his hair was not combed. And he was irate because he was embarrassed, right?
Okay.
That is, to me, was a clear sign something's wrong. Who gets that angry? I understand you want to look good, but you don't get that angry. That response was way out of proportion to the incident. So to me, that was my signal. I was like, something's going on with this boy. And as it turned out, he had clinical depression because the parents were going through a divorce. But anger is acceptable. And what does anger do? Pushes everybody away. If I'm angry enough, you're going to back up off me and leave me alone, which is what I want anyway. So those are some of the signs and symptoms that we'll see in our young people.
Question for you.
Yeah.
And I don't know what level you can answer this, but I'm going to ask it anyway.
Okay.
Because I have a question, because I see it a lot in our community.
Yeah.
We seem to really, and I hope I'm not stepping on anybody's toes, we seem to really be quick at medicating our children.
It's not out of line. It's a great question.
And it seems like you just said, our everybody needs to know their people group. Everybody needs to know their community.
Yes.
But it seems like with our younger kids,
yes,
that's the one that gets me. Like, they like 7, 8, 9, and they're not out here harming animals or anything like that. And the first thing to do is they got ADHD, give them medicine, or they got this, they got that. And it's like, do you think sometimes we're too quick to pull the trigger? And the reason I ask that is because I know that there can be some diagnosis prior to our parents really seeking the help prior to, or they just going the medication route just right off the break. Like, what are your kind of overarching thoughts on that, if I can ask?
So you raised a critical question. I would have felt like we didn't do our job if that question didn't come up, especially for us as Black people and people of color in general, particularly Blacks and Latinx folks.
Okay.
That question always comes up. It's a wonderful question. So I tell everybody this is a succinct way to answer the question. And then if you want, I can elaborate. There's the quick way, there's the slow way, and there's the best way.
Okay.
Quick way is you give your child some meds. Whatever those symptoms are, the meds probably will bring the symptoms down some. Now, it's not going to eradicate them because that's not what it's for, right? That's the quick way. In about 2 weeks, depending on the medication and depending on the illness, you probably will see some change in that child's behavior. Quick. The slow way that people don't want to take the time to do often, not always, is talk therapy, where you actually have to go sit down, 50 minutes a week, sometimes 30 minutes a week, weekly, for 12, 14, 18, 52 weeks, and work through and talk through what the issues are with the child, both the child, him or herself, or themselves, and the parents separately, and then everybody together, right? That's the slow way. You got to think. It takes time to unpack all those negative influences, all those maladaptive behaviors, like to just have conversation about what's going on, for the person to open up. That's the slow way, right? Because I'm a stranger when they come to me. Even though I'm Black, I'm still a stranger. That's the slow way. The best way is to find, if it's right for you, a combination. Sometimes I've seen medication work wonders. Mm-hmm. I've seen it work wonders for people. And when I started my career, I was not about meds at all, but I have seen it work wonders.
Okay, right.
If it's prescribed right, if people take it like they're supposed to, and if it is in conjunction with talk therapy. You cannot, I never advise people to just take meds and don't do talk therapy, because what the med is not a cure. The cure is in your developing skills to help you cope. That's the cure, right? And it helps you manage what you're going through. Recognize it when it's bubbling up, manage it so you can bring it back down, and prevent it, right? That's why I meditate, because I have anxiety, to prevent the onset of the anxiety, all that spinning and swirling that goes on.
Mhm.
So that's what I tell people. So, but I'm happy to elaborate if you have additional questions. But yeah,
No, I mean, I want to be mindful of our time.
sure,
Maybe in a future episode we can kind of
sure,
go into that. But I think that was a really, because I just see it a lot, and it's concerning because I never see the talk therapy side of it. It's just always medicine, and at some point in my mind, I'm kind of like, so like, how long is this supposed to last? Like, ever? Not forever, but ever.
right,
Just
yeah,
how long is supposed to? So okay, I think that was a great answer
okay,
to that segment based on what we're talking about here.
okay,
So just move along, because go ahead and get you out of here.
okay,
Um, we're past the point of being able to recognize the signs and symptoms.
yes,
We're in depression at this point with our
yes,
kids.
yes,
What are, if you could maybe give two or three, maybe a top two or three things
yes.
that a parent can do to assist their children in walking out of depression, or at least getting pointed in the right direction, some things, practical things that we could do at home.
Yes. One is, as I said earlier, you have to communicate with your child. And when I say communicate with your child, you have to be having ongoing, regular conversations. So one of the ways I teach families to do this is I will say, okay, you just pick an activity once a week. It can be 5 to 15 minutes. It can be 30 minutes. It can be an hour. But if you're being honest, you know your child probably don't want to, I know mine don't want to be bothered with you for no hour. So you pick 15, 20 minutes. Do something simple. Don't do an activity where you just sit and talk to each other. Find an enjoyable activity that both of you can do that doesn't require you to be like necessarily looking directly at each other. So I will
Okay.
say, if they like video games, my son likes NBA 2K. I'm horrible at it, but I'll say, or Madden. I say, let's do that quick round where the quarters last 2 minutes. Let's play that right quick, right? And then 15 minutes, we're done with the game. But I've been getting all these little nuggets while we've been talking, right? So maybe the phone
Okay.
will buzz, and I'll be like, "Who is that?" And my
Mhm.
son will be like, I'm making up a name. Oh, that was Jonathan. He just wanted to talk about blah, blah, blah. So what are you doing, right? You're having a conversation, not about Madden, but about what's going on in your kid's life. So now you know
Okay.
the name of a new friend that you probably didn't know before. Now
Okay.
you've got, like, that's reconnaissance. You're doing reconnaissance, right? But it
Right.
doesn't necessarily look like that. So that's one. Find an enjoyable activity that both of you like to, even if it's going to get ice cream. Well, not right now, but like, or Rita's. I like the Rita's Italian ice.
Right. Right. Right.
So do my hips. But anyway, so it's that kind of thing. So that's one. Two, so it's the open lines of communication. Two is, we as parents have to raise our own awareness about what depressive illness looks like in our kids, like you've done for so many people today. You need to understand what the signs and symptoms are. You can Google that, but what I always caution Black families and families of color to do is to pay attention to resources that focus on who you are as a person of color, right?
Right.
So you need to be aware for a Black person, a Latinx person, an Asian American, a Native American, even a MENA or Arab, Middle Eastern person. You need to understand, how might depression show up in people from your cultural group. For some cultural groups, outward expression of emotion, that's not a good thing. So you don't do it, right? And so you may not
That's
see the
good.
crying and
That's
stuff, because
good.
that's not what we do in our culture.
Mm-hmm.
So no signs and symptoms. Three is, we as parents, this is a biggie for me, we have
Mm-hmm.
to model the importance of mental health and caring for our emotional well-being. As I was gonna say, my friend, I know him, but I don't know that we're friends. As I've heard Charlemagne the God say, taking care of your mental wealth,
Right.
right? You have to prioritize your mental health as a parent. That's modeling for your child. They need to see you exercising. They need to see you meditating. Whatever you do, they need to see you praying. They need to see you actively engaged. And then maybe you have your own mental health professional that you see. They need to see that, so that maybe they see you read books, so
Mm-hmm.
that they understand that my mental health is just as important as any other part of who I am. And I have a parent who prioritizes this, which means I should prioritize it as a team. And that's somebody I can go talk to when something's going on. But that third one, I don't know that we as parents of color and Black parents always do
Wow. This is a lot of nuggets.
that.
And I from being around you for what, the past 8 months, six,
Yeah,
7 months, it seemed like I had heard a lot of it, but I don't think we had scratched the surface before. This has been really good information. I do have one question that came in.
sure, sure.
And the question is, how do we get our kids to see the future of their consequences versus the moment, so that they can think wiser in the moment beyond their current situation or moment?
Wow. First of all, whoever that is, thank you for that deep question. I appreciate you making me think. That I think helping children be, it's sort of like being future oriented and present oriented at the same time. And I think part of that is this idea of modeling. How do we as parents model for our kids future orientation versus present orientation? What are the conversations we're having with our children? Like, I am like really, I love clothes and shoes, right? What are the conversations I'm having with my child about? Okay, I just got this check for, I'm just making up $800. Now I can go buy me some Louboutins, some red bottoms because I love them, or I can pay for your soccer, right? For your soccer camp. I want you to see me, baby. I'm paying for your soccer camp, right? I can go do something else to get my shoes that I want. Your soccer camp is a priority for me, and that's important. That is teaching them that there are always choices. I think it is modeling that for them. It is also, you don't wait until you're in the situation to ask your child to make better decisions, long-term decisions versus short-term decisions. And you sit down and you talk with them when they mess up, right? In the moment. You don't wait 10 weeks and say, well, you remember back that time when I told you to do so-and-so and you went and did something else and then you got in trouble? No, in the moment, you have to sit down and have a conversation with your child and ask questions. And then you have to listen to the answers and non-judgmentally respond, which means what you have to do, you have to take a beat. Because a lot of times we end up in these conversations when we're angry. I know this because I'm a parent. You know it because you're a parent.
Right.
That's not the time to have the conversation. So you take 5 minutes. I tell people, go to neutral corners, go to the bathroom, sit in the bathroom, do your deep breathing, take a breath, tell your child, I'm going to need you to go in your room for 5 minutes. And then we're going to have this conversation. And then you come back together in the moment and you start with things like, tell me what happened. And just, I'm going to listen, baby. I'm not going to say anything. Just tell me what happened. What were you thinking when you did that? And give them an opportunity to explain themselves, because maybe there's some explanation that you hadn't considered that made them do and act quickly in that moment. But you need to know who your child is in order to discern that. And the only way you can develop that discernment is to be in regular communication with your child. So it's not immediate, and you have to be patient. You have to wait and see how this unfolds over time. But your job is to be consistent, actively consistent during that walk. It's a journey, right? It's a marathon. It's not a sprint. You don't talk to them once and they get it. We know that because we did. Right. So I think that's how you handle communication, patience, modeling, and then those coping mechanisms. Take a beat before you go in on them. And when you do all of those things for your child, I think you will over time start to see them making better decisions, long-term instead of short-term.
Okay. Wow. I think this time that we're in, although there's a lot of unfortunate things that are happening around us in our society, I've been trying to encourage people, if you can take any positive out of this, it's the time that we have together, because I think a lot of the information that you're sharing right now, can be applied right now because everybody's together. Like you can really, like even my son, like, he's not seeing his friends at school. So what are they doing? They're on Xbox Live, Fortnite, getting it. And I'm like, who's on? What are y'all talking about? Okay. And so I'm learning this because at the same time, we're used to being around each other for this amount of time during the day. Now it's like,
that's right.
Like, you still here? Like,
when you leave it, right?
So look, I am beyond grateful that you took time out of your schedule to jump on this podcast with us. You definitely have set the bar really high.
Thank you.
So I got to go through my list of people and make sure, like, do y'all qualify now? But no, thank you so much. And before we leave, I want you to tell everyone where they can find you on social media, your website, any information, just in case people need to get in contact with you, and if you want to mention the Acoma Project as well, please feel free to share that information.
Thank you so much. I just so deeply appreciate you, my brother, and you're just wonderful. And of course, I'm gonna wish you and your family all the best through this time. So I want to make sure I say that and express my gratitude. So the places where people can find me, there are a couple. There are 3 primary areas. One is my website, dralfiee.com, DRALFIEE. Dr. Alfiee, it's all run together.com. You can find all kinds of information about me there. You can actually get in contact with me through we have a contact page on that website. And a lot of your pictures are on that website. You can also get in touch with me. We also have a new podcast, Couched in Color with Dr. Alfiee, that's on Instagram. We have a Twitter page. We're on Libsyn. You can just download the audio. And we have a YouTube channel, Couched in Color with Dr. Alfiee. And that just started last week. And this week, we're going to have teenagers on there talking about Black teenagers talking about their own experience. And then finally, my heart, the nonprofit that I founded called the Acoma Project, AA, K as in kite, O, M as in Mary, A. Acoma Project, all one word. We have a website. We're on Instagram. We're on Twitter. And actually, all of that, we're on LinkedIn. So those are all ways. There are plenty of ways to find me and get in touch with me. If you just Google Dr. Alfiee, there's only one with two E's at the end of her name. And so you can find me that way too. So I really appreciate you giving me an opportunity to plug the podcast and the nonprofit and my website. Thank you.
Most definitely, most definitely. So everyone, thanks for tuning in today. This was special, you guys. We had this in the works for a little bit. You can find us at 300 Fathers, the number 300, the word fathers, everywhere, all over social media. And until the next one, I just want you guys, make sure you lock in. We'll be doing this again soon. But thanks so much for tuning in, guys. Until the next one, you guys take care and God bless. Hold on one second.